Hello and welcome to the latest Insights Live Preparing for Healthcare in Retirement. I'm Susie Allen, Vice President of Insights from Fidelity Wealth Management. Thank you for joining us and submitting questions. Your questions really help shape our discussion. So today we will cover everything from health savings accounts, long-term care strategies, Medicare coverage, and more. This is an important topic with a lot to cover, so let's dive right in. But before we get going, please know Fidelity does not give tax or legal advice, and nothing we discuss today should be interpreted as tax or legal advice. The information we are providing is going to be general in nature, and it may not apply to your situation. If you have legal or tax questions about your specific situation, we encourage you to talk to your attorney or tax professional. All right, to kick us off, let's introduce the fantastic team of Fidelity professionals who are here with us today. I'll ask them to introduce themselves and briefly describe their role. So Chris, let's start with you.
All right. Thank you, Susie. My name is Chris Don. I'm a vice president and financial consultant based out of Houston, but I've got clients that do work or live all around the country. I've been at Fidelity for over 25 years, helping clients plan and invest for all phases of life, including healthcare. I'm a certified equity professional and a certified financial planner.
And Sarah.
Hi, Susie, and hi, everyone. Excited to be here today. I'm Sarah Haflett. I am a vice president at Fidelity and coming to you from Pennsylvania. I co-lead our Fidelity Health Thought Leadership team, and our team is very focused on developing original research and insights and publishing reports that help people make smarter decisions regarding their health benefits and managing their healthcare costs.
My name is Jason Webb. I am a regional vice president with Fidelity's insurance agency. I am a certified financial planner with over 17 years of experience here at Fidelity, helping clients and advisors create and implement retirement plans.
Well, Chris, you work with clients every day to help them create retirement plans. How do you plan for healthcare costs as a part of that?
Yeah, great question, Susie. Like anything else, first step is try to gather as much information as you can. First question is going to be, what benefits are you eligible for? A lot of companies do have retiree health plans, but if not, there are other avenues such as COBRA, which we'll talk about later, retiree reimbursement accounts, which are slightly different than health savings accounts. Some people do have veterans, government benefits, Medicare, Medicaid, or if they don't have those options, maybe they're self-funding and using healthcare.gov to bridge the gap to Medicare. So the first step is just gather the information. What do we have available? Second, we'd like to find out, who are you covering? Are you single, married? Do you have children that are under the age of 26 or children with disabilities? That can all dictate what eligibility you have and what plans are available to you, but also what cost can we expect? So the first two things, just figuring that out. Location, another area of concern is cost of insurance, cost of medical care is different in Houston than it may be in New York. So where are you going to be living in early retirement, later in retirement? That can all drive healthcare costs, whether it be for just general healthcare, long-term care, just location. Where do you live? And right now, budgeting is not the biggest concern for most folks when they're paying for it just based through payroll deductions. It's nothing out of pocket in a lot of cases. It just comes from your paycheck, so you don't see it. It's not a real expense. It is there, but kind of in the back of your mind. But in retirement, it comes to the forefront. You have to pay those either via direct debit from your bank account, write a check, or it's deducted automatically from benefits like pension, Social Security. And once we have all that information, all those details we use from a planning standpoint, I live and breathe almost every day in Fidelity's Planning and Guidance Center. Those that have access to their accounts and online access have access to it themselves. So you can use that information on your own or with us as an advisor. And we'll cover a lot of these topics during our time today.
I'm looking forward to it. Well, how can someone go about estimating the costs of healthcare throughout retirement years? Sarah, can you help us here?
Sure. Many people are very unaware of what they will have to pay for healthcare in retirement. And unfortunately, spoiler alert, Medicare doesn't pay for everything. And many people think that once they get to Medicare age, everything will be taken care of, but that's just not the case. And so it's really important to understand, what you might be expecting to spend. on your healthcare outside of Medicare during retirement. It's very difficult for the average person to estimate what they're going to need, but fortunately here at Fidelity, we have a team that publishes an estimate of retirement costs in retirement healthcare costs each year. This year's was just released and revealed that a 65-year-old retiring today in 2025 can expect to spend on average $172,500 on healthcare and medical expenses throughout retirement. So big ticket item here. This is beyond what Medicare pays for. And it doesn't include long-term care expenses such as nursing home care or assisted living care or home health care. These costs could be higher for women because women tend to live longer than men do. If we just kind of think about putting that number into a little bit of context, breaking it down, so that $172,500 kind of breaks down into medical expenses like co-payments and co-insurance, deductibles for doctor visits and hospital visits, also Medicare Part B and Part D premiums, and we're going to talk about that a little bit later. And then finally, out-of-pocket prescription drug costs. So that's kind of the makeup of that number. When we surveyed, did our research and surveyed consumers to understand what they expect to pay for healthcare and retirement, we found that about 2/3 of workers over the age of 55 thought that they would spend about $75,000 in retirement on healthcare. So that's a gap of nearly $100,000 between what today's workers are expecting to pay in retirement and what they actually might experience when they retire.
Wow. Well, Sarah mentioned that Fidelity's estimate doesn't include long-term care. So, Jason, what should people know about long-term care costs?
Yeah, so I'm glad you bring that up, Susie. And it is important to understand that long-term care costs are not included in that survey. When I do think about long-term care costs, there are a few things I want to make sure that people understand. Number one is that long-term care events are more common than most people think. Statistically speaking, for a person turning 65 today, there's almost a 70% chance of needing some type of long-term care. We also know that the average length of long-term care services is approximately 3 years, with around 20% of individuals needing care 5 years or longer, especially those suffering from cognitive impairments like Alzheimer's or other cases of dementia. The cost of long-term care, too, is the cost of long-term care continues to rise. So as you can see here, based on the Genworth study from 2023, their cost of care survey, we have seen the cost of long-term care rise anywhere from 79% to 123% over the last 19 years, depending on where a person receives care. Now, considering there's 11,000 Americans turning 65 every day, the chances are those costs will continue to rise. The third point I would like to highlight is that all those social programs like Medicare may provide short-term coverage to help with things like post-hospital recovery. They are not designed to cover long-term care expenses. So based on this, many families often end up having to shoulder the burden of covering these expenses, which can lead to emotional, physical, and financial strains. The good news is that individuals and families can plan ahead to help address these costs.
So now that we've unpacked the concerns, let's talk strategies. We'll start with Medicare. We get a lot of questions from clients about this program. So Sarah, can you walk us through the basics of Medicare coverage?
Sure, and you're right, Susie. So many questions about this because it is actually pretty complicated. There are a lot of moving parts and a lot of decisions to make. The Medicare enrollment process can be really confusing, especially when we think about what we're used to, with our employers and getting our insurance through our employer-sponsored health plans, where we may have one or two or maybe three choices that our employer has already narrowed down for us, done all of that research for us and narrowed it down to what they believe are the best selections for us. Now, let's look at going into Medicare and that process for choosing a plan. People can have dozens of plans to choose from when they're enrolling in Medicare. And people are largely on their own to decide what plan is best for them. So they don't have anybody kind of curating that list of many, many plans for them. Many people also don't realize how Medicare coverage works and how many different ways there are to obtain coverage. We found that in our research, 40% of Medicare enrollees that we surveyed said it was difficult for them to select a plan. So we can talk a little bit about the basics of Medicare and all of the different parts that make up Medicare. Each of these parts provide a different type of healthcare coverage. So it's really no wonder people can get confused pretty quickly. So we have Original Medicare, which includes both Part A and Part B. Those plans are administered by the federal government. You can enroll in Part A at the same time as Part B, or you can enroll in them separately. Part A is, think about your hospital insurance. Most people don't pay the Part A premium because we have been paying into Medicare through our Medicare taxes while we've been working. Part B, on the other hand, which is our medical insurance, the medical insurance component of Medicare, covers medically necessary services and preventive services. So think about your outpatient services, doctor visits, maybe some labs. Almost everyone pays the Part B premium. So thinking about those two parts as Original Medicare. Part A and Part B also have deductibles. So that's the amount that you have to pay before your insurance starts to cover your services. They also have co-insurance, and there's also no limit on what a person can pay out of pocket in a given year if that's the only coverage you have. Original Medicare pays for about 80% of the cost of covered services, and it doesn't cover most prescription drugs or other benefits such as vision, dental, or hearing services.
I want to follow up on that point about coverage. It sounds like Medicare on its own doesn't cover what many people may be used to with a private healthcare plan. So are there options to get more complete coverage?
There are, and many people choose to buy additional Medicare insurance to pay for what the Original Medicare doesn't cover, so Parts A and Part A and Part B. There are a few different options. So some people choose a Medicare supplement plan, also known as a Medigap plan, and or a Part D prescription drug plan, which is exactly how it covers your prescription drugs. Others choose a third option, which is called a Medicare Advantage plan, and this is also known as Medicare Part C. So a lot of acronyms and a lot of letters here when it comes to Medicare and understanding the different plans and coverage. If we look at Medicare supplement plans, those are the types of plans that are going to help you pay your share of healthcare costs, such as co-pays, the co-insurance, the deductibles that I was talking about before. Part D, prescription drug plans help you pay for medications you buy from your pharmacy or through a mail order pharmacy service. And then Medicare Advantage, so this is that Part C, those plans are sometimes referred to as an all-in-one option. They actually combine Original Medicare services with benefits like vision, dental, and hearing, and potentially prescription drug coverage as well. These plans sometimes are desirable for people because they actually come with a pretty low premium, sometimes as low as $0. But there are some restrictions on which doctors you can see and within a certain geographic area.
That was a very comprehensive overview. Appreciate it. And now that we've explained coverage, what can you expect to pay for your Medicare plan? Chris, let's hear from you.
Sure. As Sarah mentioned, most people don't have to pay for Part A, but there are some caveats to that. Part A is free for those that paid into Social Security, but if you worked less than 40 quarters, basically 10 years, there is a cost to Part A, and it can be as much as $500 per month. But as long as you had a spouse that worked those quarters or you worked those quarters, Part A is free. Part B, though, has a baseline cost and then an escalator cost. And one of the other acronyms we get into with Medicare is IRMA, Income-Related Medicare Adjustment Amount. And think of that as the extra amount you have to pay because you have too much income. The baseline cost is $185 per month, and that's adjusted each year with inflation. Inflation numbers come out usually in the October-November timeframe from the government. That IRMA amount, at $185, depending on your income, it can double or triple the cost of coverage for each person if your modified adjusted gross income is over a certain threshold. So think of $185 times 2 for a couple. It could be $500 times 2 for a couple if you go above those IRMA thresholds. What goes into modified adjusted gross income? All forms of income. It can be IRA withdrawals, dividends and capital gains, the tax-free portion of Social Security, even tax-free income from municipal bonds. And IRMA does have a 2-year look back, meaning your premiums are based on your income from 2 years ago, not maybe the income you're going to have in retirement. So there is a reprieve if you do have a life-changing event, work stoppage, spouse passes away, marriage, something changes that is a life-changing event. You can basically petition Social Security and Medicare to not look back 2 years because of that event. You can fill out a form called Social Security Form 44. It's on the Social Security website along with Medicare, but if you have questions, talk to an accountant, financial professional, if you have specific questions on your situation. And Part D also is subject to IRMA and that same Social Security Form 44. So again, if there's life-changing events, it's important to keep that in mind. If not, you're paying higher premiums for several years when you don't need to. After those basic coverage, then, like Sarah said, there are supplemental or advantage plans or retiree medical plans that also need to be included. So very quickly, we start adding up those numbers. It could be $1,000, $1,200 a month for a couple. That $172,500 we mentioned earlier, that can get used up over a 10, 20, 30-year period of retirement. And for those that are approaching Medicare age, if you're 64 years of age or older, Fidelity does have a Medicare services group able to analyze your current situation, look at available options out there, help you research, help you educate on what choices and what options are available. So I encourage a lot of our clients to use that service, schedule an appointment, talk to somebody, ask some questions.
Excellent. So you mentioned a life-changing event, and assuming you don't have a life-changing event, are there any strategies to help avoid IRMA?
There are a few options. I mentioned a few in the last question. Mitigating your taxable income, trying to get that modified adjusted gross income below whatever that threshold is for your filing status, single or married. And again, that number changes each year. So a few ways that you can mitigate. Consider taking a tax loss in your non-retirement accounts. What does that mean? Sell something that hasn't made money, a loser, right? A tax loss out there. You can write off up to $3,000 a year against ordinary income in losses, or you can match up unlimited losses against unlimited capital gains if you want to match that up against a winning position in your portfolio. So tax loss harvesting, end of year planning becomes very important. Along with those positions that are in your account that we look at, that you have some triggers, you could buy and sell whenever you want. Some investments, like mutual funds, are forced to pay out capital gain distributions at the end of each year. So if there is a mutual fund that has a high turnover or they have a very good year, they have to pay out their capital gains. Usually it comes end of year, November, December, but it's good to know if you have an estimate of something big coming, how can you offset that? Fidelity's resources, our webpage, towards the end of the year will give you estimates and updates that we can help you with. Other financial firms may do that as well. But trying to get a gauge of what your end of year tax situation is going to be allows you to make some decisions earlier in the year. The other impact, I mentioned tax-free interest goes into the IRMA calculation. Municipal bonds, municipal money markets, yes, they go towards the calculation, but they're usually at a lower rate, meaning you're getting a lesser amount paid to you each month or each year. So that's going to have a lesser impact, but you're also not paying federal tax, maybe not even paying state income tax on it. So it's anything we can do to lessen the total dollars that goes towards that IRMA calculation. Some other timing considerations we look at is towards the end of the year, if you don't necessarily need to take money out of a 401k or IRA, a taxable investment, do you delay that until the following year? Or if you're going to have a bonus payment, something that's big from retirement, a severance, something that's going to come in that's extraordinary, try to plan around that and either push it to the next year or delay doing some other things in that big tax year. And for those that are over the age of 70 and a half, or those that are of minimum distribution age, which is now age 73 or 75, you can do a charitable distribution from an IRA account. And that's just a tax-free withdrawal from an IRA. That doesn't go towards the IRMA calculations, but it's a way for you to satisfy those minimums that you have to take out. And for those that aren't 70 and a half, or if you want to try to increase your itemized tax deductions, the One Big Beautiful Bill added some additional considerations for standard versus itemized deductions, but a lot of clients do bunch charitable gifts, meaning maybe you do a bigger charitable gift in one year, and a lesser in 2 or 3 years after that. You're trying to get a big tax break in 1 year and not as much in future years. So those are a few ways to help soften the blow.
All right, great considerations, Chris. Well, between costs and coverage, there's clearly a lot to take into account in choosing a Medicare plan. Sarah, can you help us understand some of the factors to consider?
Susie, there are a lot of roads to Medicare, a lot of different ways that Medicare, the whole Medicare enrollment process can play out. And a person's path to Medicare is largely dictated by two main factors, age and working status. Generally, it's these two factors that will determine what types of coverage are available and the timing of their enrollment. So someone who retires before the age of 65 is in a completely different situation from someone who is 67 and still working. So let's just maybe talk a little bit about those who are continuing working past 65. For those individuals, if there is an individual working past the age of 65 who wishes to remain on their employer-sponsored insurance, there's some things to take into consideration here. These individuals must make sure that their employer coverage meets certain requirements so that they can make sure that they can delay Medicare enrollment without having to pay a penalty. These requirements are called creditable coverage, and the rules can differ based on the number of employees an employer has. So, really important to actually get in touch with your employer to understand that. Creditable coverage actually just means that the coverage that your employer is offering is and it will actually pay on average as much as Medicare would. Drug coverage also must be creditable coverage. For those who are working past their 65th birthday, there is a special enrollment period up to 8 months after your employer coverage ends to enroll in Medicare Parts A and Part B. So important to keep that in mind. You've got an 8-month window if you're working past the age of 65 and then transitioning to Medicare. Generally, even a retired person who has access to retiree health benefits through their employer must enroll in Medicare Part A and Part B to avoid late enrollment penalties and gaps in coverage. And that's something that some people might think, oh, my employer offers a retiree health benefit, I can use that. Well, they actually also must enroll in Medicare Part A and Part B. So, this transition of care between an employer plan and a Medicare plan may also leave some gaps in the benefits that an individual might have been used to from their employer, like dental, which we talked about before, vision, but even things like gym memberships and nutrition services and counseling and programs that might help with mental health that a lot of employers have invested in over the last few years, especially mental health apps, virtual care. Those types of benefits and services are not going to be available through original Medicare plans. There are certain Medicare Advantage plans that do cover those types of benefits that many workers have really gotten used to having through their employer insurance and supplemental benefits. But not everyone wants to go with Medicare Advantage. And if an individual does not want to enroll in a Medicare Advantage plan, then they also always have the option of enrolling in standalone plans for dental services and care, vision, and some of those other supplemental benefits that I mentioned. So there are, as you can see, a lot of ins and outs. And I would say my advice is if you're still enrolled in an employer group health plan and you're coming upon Medicare eligibility, just consider checking with your employer or your benefits administrator so you can understand what you need to consider for your specific situation.
Really good considerations there. So now on the flip side, Chris, if you retire before Medicare age and are no longer eligible for employer healthcare coverage, what are some of your options?
Yeah, good question, Susie, because not everybody makes it to 65, right? Whether it be a downsizing, a severance, a voluntary, or a health event may cause you to retire before 65. So before 65, first thing I look at is, do you have access to your employer's plan as a retiree? And a lot of companies have a certain age requirement you have to get to. Sometimes it's 50, sometimes it's 55 or 60, and sometimes it is 65. But if you're eligible to retire at a certain age and still get coverage, we call that bridging the gap to Medicare. So educate yourself, try to find out what options are available within your company. Talk with your benefits team, or look for a summary plan description. That's a term for pretty much any healthcare retirement plan. A summary plan description is available that basically outlines all of the details. You'll typically see it during open enrollment, but you can also go to your employer benefits website and find it as well. If your company doesn't provide retiree options for Medicare, for medical and retirement, a lot of companies have access to COBRA, which is a government program, stands for Consolidated Omnibus Budget Reconciliation Act. Basically means your employer will help you bridge a gap of up to 18 months, but it's usually at a much higher cost. It's not going to be the same cost you were paying as an active employee. So usually it's a stopgap measure, but it gives you some time to think and learn about what your options are. The other thing to think about is look at a spouse or partner's employer health plan, those life-changing events I mentioned earlier. When you leave employment, you may be able to jump on to another company or another plan during the outside of the open enrollment window. So basically that life-changing event allows you to enroll before the next annual cycle. So again, reading through that documentation becomes very important. Check with benefits, check with the group health plan options that are out there. And if all else fails, the next step is the marketplace. Healthcare.gov, the ACA marketplace, allows access to coverage, may not be at the same cost, maybe a higher cost, but could be a lower cost. There are some subsidies out there. And the recent passage of the One Big Beautiful Bill does extend coverage of these plans and make more eligible. Think of the Olympics, bronze, silver, gold. There's different types of healthcare plans that are out there. So having more plans available is a good thing. And we'll talk a little bit more on that.
Well, clearly, even in the best case scenario, healthcare retirement is a significant expense. Jason, can you explain how a health savings account can help?
Yeah, absolutely. So for those that are eligible, health savings accounts can offer many benefits to help with addressing healthcare costs in retirement. These type accounts provide what we refer to as a triple tax advantage way to save for healthcare costs. First, the contributions allow you to reduce your income in the year you contribute. Second, the assets can be invested and grow federally tax deferred. And third, any withdrawals used for qualified medical expenses are tax free. Health savings accounts can be a great way to help pay for future Medicare premiums, co-pays, deductibles, and prescription costs, as well as qualified long-term care premiums up to the IRS limits based on age. Now, it is important to note that Medicare supplement or Medigap premiums are not considered a qualified medical expense, so distributions from your HSA to pay for those premiums would not be tax-free. One last piece that I like to highlight, especially with us talking about Medicare today, is that if contributing to an HSA, a health savings account, and approaching Medicare enrollment, it is important to coordinate your final contributions before the start of Medicare coverage. This is another area people should review or consult with an advisor to avoid potential tax penalties.
Great, very helpful. So what do clients need to know about health savings account eligibility, which was just expanded in the most recent tax law? Sarah, can you help us here?
Sure, I definitely can. And I would say that, health savings accounts tend to have a lot of misconceptions, surrounding them. And we'll try to go through a couple of those right now. But, what we have found is that the health savings account can be one of the, most valuable tools to use in retirement, but it's often overlooked as a retirement planning tool. So, a lot of people don't understand that it can be used for healthcare costs in retirement. They think maybe it's just, for today's healthcare expenses, which it certainly can be used on, but it's also a great way to save for those expenses in retirement. But another reason is that in order to contribute to an HSA, you have to be enrolled in a high deductible health plan where you have to cover all of your costs up to the deductible before the insurance starts paying. And having a high deductible, just that term, can turn a lot of people away, even though this type of plan can actually be the better overall choice for many people because it comes with a lower premium and the ability to have the HSA to start contributing dollars to, as Jason was describing. Also, another kind of aspect of the HSA that not a lot of people know about is that
you own your HSA. So if you have an HSA, it is yours and it goes with you wherever you go. So even when you are no longer in a high deductible health plan, or if you change jobs, or if you retire, while you can't continue to contribute to the HSA, it's still your money to invest and use on healthcare costs.
I love the demystifying of HSAs here. So, what are strategies to make the best use of your health savings account in retirement? Chris, help us.
Yeah, this gets into the what ifs, right? A lot of clients ask me, Chris, should I be using this while I'm working, while I'm younger, before retirement, or should I let it sit there and grow, kind of like a 401k or IRA, and use it in retirement when I may need it more? So the first thing I always look at is situation, right? If you're a younger person, single, maybe a newlywed couple having a child, you may need that health savings account now versus later, and that's the priority. If you're trying to get maybe a contribution from your company. A lot of companies put a base amount into a health savings account, and then you're putting some additional pre-tax money in and taking it tax-free, right? So situational use may be an important factor there. If somebody's older, doesn't need it right now, or they're in their high income years, they may truly want to save it for retirement and let it grow, and it could be some combination approach out there. The other thing I look at is, do you have, I mentioned earlier, a retiree reimbursement account, something that your company provides? Usually that's the first pool of funds we may want to look at using, because that may not be able to pass on to beneficiaries, maybe a spouse, but not to children. HSAs do have beneficiaries, and we'll get into some strategies there as well about timing of use. And if you're married or over the age of 55, you can make a family contribution to one HSA account. There's some complexities with catch-up contributions and who has to set up an account first, but those withdrawals are tax-free if used for the current year or previous year's qualified expenses. I don't think most people realize that, but if you didn't take a withdrawal 2, 3, 5 years ago, but you had an expense that qualified while you were in a high deductible plan, you can take a lump sum withdrawal and it's still tax-free. So there are some nuances there on timing of use. And we speak about timing after the age of 65. Withdrawals don't have to be used for healthcare. They can be used for non-medical reasons, but they would be subject to income tax. So if you do end up building up an HSA account and you need some funds, think of it almost like a pre-tax 401k or IRA. And I mentioned earlier beneficiary use of HSAs. Spouses can pass that on and still receive the tax-free benefit with withdrawals for healthcare costs. But if it passes to someone else, a child, another family member, non-spousal beneficiaries, regardless of use, have to pay tax on that. So one of the strategies I talk with clients when it comes to, unfortunately, end-of-life care, or we had a huge medical expense, is, does it make sense to cash that HSA out tax-free because you had a qualifying expense, or pass it on to a family member and now they're stuck with the tax burden? And then make sure these accounts have beneficiaries listed. I see that missed quite a bit. That's not just for HSAs. That's just a general update, which we'll talk more on. But beneficiaries pass outside of a will. So making sure you've got an HSA account with a beneficiary listed and who that beneficiary is important. And if you do job switch, move from job to job, and you have multiple HSA accounts, consider consolidating them. Fidelity, and myself, I help folks move HSA accounts from other providers just for simplicity, make it easier, have it in one place.
Really important to underscore the beneficiary piece. Thank you, Chris. Jason, you had talked about long-term care earlier. So let's talk a bit more about long-term care insurance. What are the options for covering that cost?
Yeah, I appreciate the question. So essentially, there are 4 different ways to pay for long-term care. So first is personal savings, then government assistance, followed by traditional long-term care insurance, or what we call hybrid long-term care insurance, which offers life insurance with a long-term care option. So let's break each of those down, because I think it is important to understand each. So personal savings being the first one, one of the benefits to that is that your personal savings can provide flexibility and growth, but it can put a heavy strain on a family's financial wealth. So this option really should only be considered if you have substantial savings. Now, government assistance, there are federal programs that may help cover limited long-term care expenses. So for example, Medicare, which is not designed to cover long-term care services, may cover some limited benefits if they are part of the recovery process. Medicaid, on the other hand, may help low-income individuals, but that is only once a person meets eligibility requirements, which is typically after the person has exhausted their assets. TRICARE, similar to Medicare, provides limited benefits for uniformed service members, retirees, and their families, but also for veterans, there may be some assistance to the VA. On the insurance side of this, so we do have what we call traditional long-term care policies. These were commonly used types of long-term care insurance. They offer a high degree of personalization, allowing a person to choose things like their monthly payment, how long it lasts, how long they'd have to wait before receiving the benefits. However, many insurance companies no longer offer traditional policies, and those that do may raise annual premiums after purchase. An additional consideration is that many of these policies are use it or lose it, meaning that if you never need long-term care services, you don't receive any benefits. The fourth option, which is a common alternative to the traditional long-term care, are the hybrid policies. These are insurance policies that combine long-term care coverage with life insurance benefits. A hybrid policy allows people to use a portion of their savings to create a leverage pool of long-term care benefits that they can access on a monthly basis to help pay for long-term care expenses. But if you don't use the long-term care benefits, it will pay a life insurance death benefit to your beneficiaries upon death. An additional benefit of hybrid policies is that you may receive a concierge service, which helps with things like care coordination. Hybrid long-term care policies have continued to grow in popularity, and they're actually what we offer here at Fidelity. Now, which option is ultimately going to be most suitable for a client is really going to depend on his or her overall situation.
All right. Great overview. Thank you for that. Now, for clients interested in the long-term care insurance option, when should that process start?
Yeah, I can't emphasize this enough up front, which is that it's never too early to start planning for long-term care. So I have personal experience with this with a family member who suffered from a cognitive impairment. So I know exactly what this looks like. And one of the things I often tell people is it's never too early to start planning. Now, the younger you are, typically the less it's going to cost to have the coverage. In my experience, people typically buy long-term care insurance when they're in their 50s. At this stage of life, it tends to be more affordable, and you're less likely to have any type of medical issues that might potentially disqualify you from purchasing a policy. Now, this does not mean that people cannot explore long-term care coverage earlier or later in life. When I think about the process of exploring long-term care, we try to simplify here at Fidelity. It starts with a very simple, but what we consider to be an extremely impactful conversation with an advisor and with a family member. What we're looking to understand are the answers to really three questions. Number one is simply who? Who is going to take care of you? More importantly, have you had the conversation with that person? Taking that even a step further, does that person even live by you? Do they have experience with providing care? So there's a lot of questions that we try to unpack with that. The second question we want to understand is where? Where do you want to be taken care of? Is it in home through a homemaker services? Is it any type of assisted living or nursing home? Once you understand that, it really boils down then to the how. How do you plan to cover that cost? Now, once we understand your thoughts and your wishes, we can actually partner with one of our dedicated long-term care specialists that we have here at Fidelity to explore those options in more detail.
Simple questions, but really meaningful conversation. Just to expand on this a bit more, what factors can influence the cost of a long-term care insurance policy?
Yeah, so there's a variety of factors that can impact the cost of long-term care insurance. And we touched on one a moment ago, which is age, right? That the younger you are, the more cost-effective that it tends to be for the plan. Health can be another factor. So you do go through an underwriting process. So health factors will be evaluated to determine if the applicant is classified as preferred or standard, which can have an impact on premiums. Gender can have an impact as well. A single or a joint contract. What I tend to find in my day-to-day is not a lot of people are familiar with the fact that we can do some of these policies as a joint contract. So whether it's a single or joint contract between spouses, that can absolutely have an impact on it as well. And then policy features tends to be a big one, right? So this is going to be things such as like, what do you want to receive as your monthly benefit? What's the elimination period? So that's the time frame from when you have the onset of needing the long-term care to when the benefits start. And then do you want to have a COLA or a cost of living adjustment attached to that? All of these are policy features that can impact the premium. The last thing that I would highlight here is just simply where a person lives can actually be a significant driver to consider. We actually have a very good viewpoint out there called long-term care options and considerations. And as part of that viewpoint, we have embedded in there a Genworth report that allows individuals to take a look at what the current long-term care costs would be in their area, as well as potentially what the future costs might look at. And this is all dependent on looking at where they live or their zip code. So whether where they're currently at or potentially where they may plan to retire. Now, a link to that article and the study will be downloadable in the additional helpful resources that we have. But I would say those are the major factors that we look at when it comes to the impacts on the costs.
Jason, we'll let you off the hot seat for a minute here. Want to close the loop on what Chris brought up at the beginning of this webinar around non-financial healthcare considerations. So one common issue is caregiving. And Sarah, you and your team have done research on caregiving. What else do people need to know?
Yeah, Susie, we have. And I think, Jason talked a lot about the formal caregiving, right? The paid caregivers, once you potentially need long-term care services. But what about the unpaid caregiver, right? Which, really tends to happen quite often to individuals during retirement where, maybe one spouse becomes ill and the other becomes the really the day-to-day caregiver for that spouse. So these retirement, sometimes we don't think about these types of challenges in retirement when we're starting to prepare for retirement. But just to give a little bit of context in terms of what the data is saying and what the research is saying. So we found that a study by the National Council on Aging found that about a quarter of retired women are providing care for loved ones in retirement, and that women are significantly more likely than men to have caregiving responsibilities sort of overall. And we know certainly there are men who are, having to take on those responsibilities as well, but women tend to take on more of the burden of that in retirement. And obviously, when someone is trying to balance their caregiving with other demands from family demands, community responsibilities, maybe they're doing some sort of work in retirement that is unpaid, something's bound to fall through the cracks. And most of the time what we find is that it's the caregiver's own health. So, not having the time or mental capacity to kind of keep up with healthy eating habits, exercise, taking care of their mental health, those kinds of things. A recent survey that we conducted found that a third of those who are caring for a loved one with special needs in retirement rated their mental health as fair, poor, or very poor. So about a third saying, I'm not in good mental health. And about a little over a quarter said the same about their physical health, that they were, not really feeling like they were in very good physical health. Could be as a result of not being able to have the time, kind of mental capacity to kind of take care of themselves while they're taking care of someone else in the household.
Really underscores the importance of self-care when you're a caregiver yourself. Now, related to caregiving, Chris, what do clients and family members need to think about or ensure that their loved ones understand and can execute their wishes later on in life?
Yeah, it's good communication. I hear good and bad stories from clients, and having a plan in place, we say it a lot, have it in place before an event happens. And it can be as simple as just a support network, friends, family, support organizations, having somebody there to help the caregiver, because they need time alone too. Go to the gym, grocery shop, just go for a walk. They need some recovery, some mental health time. So, have that plan together if available for you. I encourage clients, look at the options available through support networks, that extended friends and family. Have some contingency plans set up, and sometimes that's in documentation, contingency plans. Know where those important documents are: power of attorneys, healthcare directives, wills. Here in Houston, we've had hurricanes and floods, and we've had people lose those hard copy documents, or a safe deposit box at the bank, floods. Those documents are gone. So have some contingency plans, some backup plans out there. Fidelity does have a great resource available under your documents and statements tab called FidSafe. Think of it like an electronic storage box out there. So fidsafe.com is the website, but you can get to it through your documents and statements section. And as you're reviewing some of those documents, power of attorneys, healthcare directives, they're great resources to speak for you when you can't speak for yourself, but I see a lot of those documents have just one line of defense. Usually it's the husband and wife. There's no backup plan. So if one spouse passes away or becomes incapacitated, or one power of attorney predeceases you or can't do it, there's no backup plan. So you may want to dust those documents off, review them, maybe have a secondary, tertiary plan, available out there. I talked to a client last week, widowed, 84 years old. He still had his wife listed as power of attorney and she's passed, right? So there is no plan right now. The courts will have to figure it out. There may need to be a guardian assigned. So don't let those things fall through the cracks. Try to get on top of it. I know it's tough when people are grieving and have had loss, but try to bounce back and get those things squared away before an event happens or shortly thereafter. And I mentioned earlier, make sure your intentions are there. Beneficiaries are the first line of defense, but wills, power of attorney documents, just spelling out what needs to occur and what needs to happen. And if you do have a long-term care policy, make sure those that are going to be utilizing that know how it works and know that you have it. And again, conversations. Family members need to know those details. Are they an executor in your will? It can help alleviate the stress. I do see a lot of clients that don't unveil the curtain. Basically, they don't share with the family members, and I'm usually the one having to share it after a life event. Certainly, I can do that, but I think it's much more impactful when it comes from the family member. It can alleviate stress for that person when they are losing a loved one, but then also trying to figure things out. So depending on the situation, I'll invite children, family members. We'll do an in-person meeting, a Zoom call, but I encourage folks do that on your own as well. It's good to have a third party or a financial advisor there in your corner, but have those family conversations yourself.
Such power in having those family conversations for sure. Well, we have covered a lot of ground today, and I'd love for each of our panelists to share a few key takeaways to leave our viewers with. So, Jason, let's start with you, please.
Yeah, so it's been a great time today. So just two things I would leave our viewers with. So one is that Fidelity views healthcare expenses as one of the 5 key risks to retirement income security. It is extremely important to understand the impact of these healthcare costs and what they will have on your retirement plan. Additionally, planning ahead for long-term care, which is a separate cost, can help families manage the physical, financial, and emotional challenges that arise when a loved one requires these services to meet their needs of daily living.
Sarah.
Yeah, I would say don't be too quick to discount enrolling in a high deductible health plan that allows you to have a health savings account. For many people, this can be the most suitable option for them because it can help them save on healthcare costs, not only today, but use those funds, saved up funds in the HSA for healthcare and retirement. I think earlier Jason said it's never too early to start planning for long-term care. I would say it's never too late to contribute to a health savings account. Often we hear in our research that people who are kind of nearing retirement age, over the age of 55, just disregard them because they think they're not worth it, but they can be. There's still time to build up funds for retirement. And then finally, I would just say, look for a Medicare advisor or broker who can provide you with easy comparisons, data-driven comparisons of different plans, their features, and also be able to provide you with greater personalization and curation of options that are available to you. And then really look for those who are really interested in offering you more of a neutral, educated, education on these plans and less of a sales pitch.
And Chris.
Yeah, we'll wrap it up here. Educate yourself on the options available. It's important. You can never have too much information. We need it as advisors to help, folks out there understand what benefits are available. So, read through it yourself, and then that helps us help you out there. Communicate with the loved ones. Let them know what your intentions are. Get the proper documentation together. And if you need help, reach out. Myself, other financial advisors here at Fidelity, but attorneys, doctors, support organizations. Reach out with questions before and during those health events.
Well, thank you, panelists. And we hope you, our viewers, will join us for part 2 of this discussion on preparing for healthcare costs in retirement on August 21st, where we'll take your questions live. In the meantime, if you have more questions about managing healthcare costs in retirement, please reach out to your Fidelity representative. And if you don't have a representative, visit fidelity.com/find-an-advisor. And for more timely market updates and insights on other financial planning topics, subscribe to Insights from Fidelity Wealth Management for exclusive invitations to future wealth management webinars and access to our weekly newsletter. Thank you so much for joining us. Hello and welcome to the latest Insights Live, Creating a Fulfilling Retirement. I'm Susie Allen, Vice President of Insights from Fidelity Wealth Management. Thank you for joining us today and submitting questions. Your questions have helped shape our discussion. Now, to have a satisfying retirement, you need a strong savings and income plan. And you also need to think about your lifestyle, relationships, the emotional aspects, and more. So today, on today's panel, we have both financial professionals and a leading researcher on retirement income and happiness, Dr. Michael Finke, who will share fascinating research on this topic. But before we get going, I want to let you know Fidelity does not give tax or legal advice, and nothing we discuss today should be interpreted as tax or legal advice. The information we are providing is going to be general in nature, and it may not apply to your situation. If you do have legal or tax questions about your specific situation, we encourage you to talk to your attorney or tax professional. So let's get going. To kick off, let's introduce our panelists who are here with us today. I'll ask them to introduce themselves and briefly describe their role. So Michael, let's kick it off.
All right. Hello, I'm Michael Finke. I'm a professor of wealth management and the Frank M. Engel Chair of Economic Security at the American College of Financial Services. And before I came to the American College, I was the director of the Retirement Planning and Living Center at Texas Tech University.
Welcome, Michael. Julie.
Hello, I'm Julie Ramos. I am a wealth planner at our Chandler, Arizona Investor Center. I've been with Fidelity for 10 years, in the industry for 17. As a wealth planner, I work with a select group of families doing specialized goal setting and wealth planning.
Excellent. And Justin.
Hi, I'm Justin Bailey. I'm a regional vice president with Fidelity Investments. My role here is I support and coach our Fidelity financial consultants on financial topics like investment management, tax planning, and of course, retirement income planning. And I've been with Fidelity over 27 years, and I am a certified financial planning professional.
All right, welcome everyone. Thank you. So let's start our discussion with the research I mentioned a moment ago. Michael, what have your studies uncovered about retirement satisfaction?
Well, let me start out by saying that in my research, I use a survey of 20,000 retirees. It started in 1994. It goes through the current day. And it has very detailed questions on life satisfaction. So I can actually go into the survey and look at the predictors of life satisfaction in retirement. And what I found is that they really cluster into three different areas. It is money, which is, I think, good news for those of us who have saved for retirement, is having more money does generally make us happier, although it does tend to level out at about $4.5 million or so after that. It's not making us quite as happy, but money makes us happy. Also, the form of money, which is something we'll talk about later. Some people hold wealth in investments, some people hold wealth in pensions. There's a difference between the two when we look at life satisfaction. Also, relationships. Not surprisingly, relationships are a very important predictor of life satisfaction. The relationship that you have with your primary partner or your spouse is the most important relationship that you have in retirement, but also the relationships that we have with our friends. It seems that they become even more important in retirement because we're spending more time in leisure. So we get to draw from those friendships even more than we had in the past. And by the way, children, not a significant source of life satisfaction in retirement. So this has some implications if you're thinking of moving close to your kids. It's really your primary relationship and your friends that are the most important predictors of life satisfaction. And then the third pillar of life satisfaction is health. Obviously, you can have money and you can not have health and not be very satisfied in retirement. So it's really, what I see is that all three of those areas can combine satisfaction. And very often it takes not just money, because remember, money is just green paper or dots on a computer screen. It takes some combination of the money and relationships and health to be able to produce a more satisfying retirement. What the three have in common is that they're all investments. So what is an investment? An investment is a sacrifice that we can make today in order to live better in the future. So it's easy to see why a financial investment is an investment, because that's money that I could have spent on going out to dinner today, or I could buy a nicer car or a bigger house, but instead I save it for the future so that I can live better in the future. So that's really the definition of what an investment is. But it also characterizes health. I can make an investment in my health today in order to live a more active and a longer retirement. And I can make investments in my relationships. I can go to visit a friend today. I can maintain those friendships that I have during my working years so that I can then draw on those in retirement.
All right, awesome. That's so interesting to hear about these investments, and we'll talk about more of that soon. So a lot of us understandably focus on planning for our retirement expenses and not as much about planning for our time. So how should we think about our lives in retirement? Or put in another way, how do we avoid becoming bored?
Well, I actually have a collection of photographs of couples sitting on the beach watching the ocean from financial services companies. So it's kind of ubiquitous. In order to motivate people to save for retirement, you have to get them to imagine buying a beach house and then sitting in beach chairs and looking at the ocean. But the reality is that when you do that and you sit there looking at the ocean, after about half an hour, you probably start getting bored. And then you realize, well, this isn't it. One of the mistakes I think people make is that we think about retirement as being a very long weekend. And we think that many of the things that we enjoy doing on the weekend, like playing golf or, going out to the beach or going to the mountains, these are things to get away from a life where we've had a lot of structure, a lot of engagement, social engagement. We've had challenges in the workplace. And then the weekends are all about getting away from that. I mean, that creates a certain amount of balance in our lives. But in retirement, if that's all we do, then it can seem a bit imbalanced. So what ends up happening is that oftentimes people become socially isolated in retirement and they become bored. And you really have to think in advance about how you're going to fill your days. How are you going to get that same sense of fulfillment and engagement? And what I found is that it's very often about habits. It's about thinking ahead of time, what sort of habits am I going to develop? Because honestly, the number one time use among retirees other than sleeping is watching television. And if we can end up falling into, I think, a bit of a rut in retirement unless we plan for a more satisfying retirement. And I think a lot of that is really down to social engagement. One of the worst things that can happen is that we can become more socially isolated.
Excellent, thank you. Well, Julie, you see this in action every day when you work with clients. So how do you help your clients establish their vision of retirement?
Yeah, thanks, Susie. This is one of my favorite parts of the planning process because everyone's vision of retirement is so personal and unique. I always start by encouraging them to dream a little. I'll ask them, if you could design your perfect week in retirement, what would that look like? They don't usually tell me it's watching TV. Sometimes people are surprised by what they come up with, though. Let me share a story. I had a client who was really struggling with this. She had two big passions, a love for competitive ballroom dancing that she had enjoyed for years, and she knew she wanted to spend more time with her grandkids in retirement as well. She felt like she had to pick one over the other, and it was causing her a lot of stress. So we spent time talking about what each activity meant to her, how it contributed to her sense of purpose and happiness. And through these conversations, she realized she didn't have to choose. And we worked to create a retirement plan that allowed her to take dance classes a few times a week and also set aside dedicated time for her grandkids. And then we built in a budget both for dance trips and family trips. And what I've learned is that retirement isn't about giving up these things, but finding the right balance. And my role is to listen, ask thoughtful questions, and help clients see what their retirement can be both exciting and fulfilling.
Love that. Thank you so much, Julie. And I do love the idea of balance, and it's so important to find balance in all parts of your life, certainly. So, Michael, what has your research found about retirement expenses?
Yeah, I mean, I get this question a lot. What are my retirement expenses going to look like? And let's take a step back and think about what were my expenses like before I retired. And for a lot of people, they're not spending all of their salary. They're saving a portion of their salary. They might be saving 15% for retirement. They're paying payroll taxes. If you really want to replace the lifestyle that you had before retirement, it may be closer to about 60% for those higher earning Americans. So that's good news in the sense that that really is the lifestyle that you need to be able to replace. Now, it does make some sense to track that a bit before retirement. What I find is that retirees, the first year of retirement, spend almost exactly the same on average as they did the year before they retired, because we're creatures of habit. We tend to live in the same house very often. We pay payroll, or we pay property taxes on the house and utilities. We go to the grocery store. You know, we tend to have the same lifestyle that we did before retirement. The expenses are a little bit different. Now, one of the big differences is that the research has found that there are some retirees who spend a lot more after they retire. I call them the RV retirees, the ones who decide that they're going to spend a lot of money on living it up, whether it's buying an RV or buying something else, you know, going on vacation. But that tends to even out over time. And by the way, RVs are a great example of spending in retirement that some people get wrong, and some people, it's a great idea. So I have a friend who's a financial advisor, and whenever one of his clients would come in and say, I'm thinking of buying an RV after I retire, he'd say, that is a great idea. You know, you get to see the country, you're going to have a wonderful time. Why don't you rent a mid-size RV for a month? And then what I find is that some of my clients, they want a little bit more space, so they end up buying a bigger motorhome, or some of them want something a little bit more compact and maneuverable. So rent a mid-size RV for a month. And he made that recommendation because he knew that about 2/3 of his clients, after spending a month in a motorhome, would never want to get in one again. So I thought that was brilliant. So what ends up happening is that there is a certain type of retiree who maybe gets in the motorhome, goes from one RV park to another, sees national parks or monuments, and then they get back to the park, and then they plug in and watch cable TV and get up the next morning and go for a drive. They're basically underpaid truck drivers. And there's other types of RV owners that will get to the park and they'll put up a sign saying, hey, it's the Campbells, welcome, say hello. They use it as an opportunity for increased social engagement. And that's really the bottom line when it comes to spending on things like, you know, a motorhome or even a classic car. If it provides an entree into social engagement, then it's likely to be a successful purchase. So if you're someone who's always wanted to buy the classic car, then I think it's actually, especially for men, because men do become more vulnerable to social isolation in retirement, go ahead and buy the classic car because it's really entree into a social group. You get to, you know, take the cars and coffee, and you get to go online and talk to other people that own the car. That's the kind of spending that really leads to the greatest amount of life satisfaction.
Well, I love the idea of social spending. I probably do some, I'm probably pretty good at that, let's just say. All right, well, speaking of expenses, housing is one of the biggest for many retirees. We covered this recently in a program. And so one of the biggest decisions many of us make about retirement is where to live. So Justin, what are your thoughts about that decision?
Yeah, now that we're in retirement and I don't have a employer holding me down, I can be more mobile and move around. However, there are some financial considerations to think about. And I think most of us want to anticipate, or kind of, I guess, as those pictures show that Michael shared, maybe closer to a beach or in a more warmer climate. But there is going to be some costs. So here's a few questions to consider. Wherever I'm going to be looking at relocating, first of all, are those cost of living factors going to increase or decrease? Maybe if I get closer to the beach, all of a sudden I have flood insurance I'm going to have to start paying for, or something like that. So we have to make sure that we understand those costs. Also, we're probably going to be drawn to maybe where our taxes are going to be impacting us. Are there states with higher taxes or lower taxes? And maybe there's some local taxes that we need to be considerate of. Also, the hope, and I love what Michael's saying about social engagement. Hopefully I'm going to move something closer to a hobby or an activity that makes me more interactive with others, maybe closer to family. But remember, maybe that's an activity that I haven't used or haven't been a part of. Is that going to be increasing costs? So we just want to make sure that we know what we're signing up for and that we have budgeted for that. I'd say this though, I know we can go online. We can probably do some comparison pricing out there, but the best thing to do is actually, and I'd like to steal that idea about the RV, maybe if I'm going to move to a location, maybe a warmer climate, maybe I rent for a little while so that I understand what are the neighborhoods instead of just going straight by, because maybe I don't want to be that close to the beach because I get tired of the sand and I'd rather live 5 miles in from the beach, right? And maybe my flood insurance is a little bit cheaper. But also talk to some of the professionals there, obviously family, friends, neighbors, but also real estate agents and others that would give you a good idea of what that cost would be. One more thing to consider is I think we're always thinking about those first handful of years of retirement, but maybe stretch us to think a little bit beyond that, maybe 10, 12, 15 years out, because this is a location of where we're going to be aging. So this is where I want to talk about aging costs. And I'm not talking long-term care. I'm just talking maybe there's a point I'm going to slow down. Maybe my faculties will get a little slower. Maybe I need some house upkeep. So what would that cost? Yard maintenance. Maybe I need some help with shopping. All those kind of things on top of, do I have access to the doctors that I'm going to need, some of the physical therapy, all those costs kind of come into the decision of where I want to locate.
All right, well, these are really good considerations, and I love the idea of what are some of the shorter term considerations and things to think about for the longer term as well. So, Michael, do you have any thoughts to add to this?
Yeah, Justin mentions that you need to give thoughts to the different stages of retirement, especially when it comes to housing. And research shows that if you're living in your own home, over the course of your lifetime, you're generally happier than people who are in more shared living types of environments like apartments or condos until you hit your 80s. And then once you hit your 80s, people who live in shared environments are actually happier than those who live in their own home. And I think one of the reasons is because as we get older, we do become more vulnerable to social isolation. We change physically, we change cognitively, and it's a little depressing, but fewer of our friends are around by the time we hit our 80s. So I think it's actually a good idea to plan ahead. Let's say at the very outset of retirement, you do a little bit of looking around for a type of living environment that you want to transition into, maybe 15, maybe 20 years into retirement, but you should recognize that you're going to actually prefer that kind of a living environment at some point. And what I see happening all too often is that it is very often the children or other friends of an older person who end up having to move them into a different living environment, but not necessarily on their own terms. So if you can do it on your own terms ahead of time, if you can make that choice in advance, it really saves a big burden off of those who have to make that decision for you. And it allows you to transition into the kind of place that you want to spend that latter part of retirement. So I think part of retirement planning is recognizing that there are these different stages, and you're probably going to be happier in some of those latter stages in a different type of living environment than your house.
All right, that's very helpful. So let's talk about investing in your health, a key pillar of retirement happiness. So, Michael, when you say that, what exactly do you mean?
Yeah, so I did a study about a year ago with a guy named David Stewart. He has a website called superage.com, and David is very big on healthy aging. And his idea is that aging is an aspirational life cycle stage. We can enjoy our lives into our 60s, 70s, and 80s, but it requires a certain level of physical capabilities. And I want to, when I get to retirement, go hiking in Switzerland. And so, of course, I need to save up to be able to fly there. I need to rent a chalet, but I also need to be physically able to go for a hike in the mountains. And that's not easy. It requires a certain level of fitness. And there is this thing called VO2 max, which is our body's ability to process oxygen. And it tends to decline as we get older, but it doesn't decline as much if we're more physically fit. So we can actually make an investment in our physical fitness. And I bought one of those expensive watches that tracks my VO2 max, and it's actually motivated me to maintain my fitness. If the number starts going down, then I realize I have to exercise a little bit more, but I'm doing it because I'm motivated by living better in the future. And I think it's something to keep in mind when you're my age and maybe a decade out of retirement, that it's not just I need to save enough money. Oftentimes we think of retirement planning as a numbers game, but it's also going to require an investment both in friendships and in health. And if I don't make that investment in health, what is the use of the money? It's not going to be as enjoyable.
Well, I love that idea of being motivated by wellness. So, besides investing in wellness, what are some strategies to plan for covering later in life healthcare expenses? Justin, can you help us with that, please?
Yeah, so based on some of our recent research from Fidelity, the average 65-year-old individual who's retired will spend about 165,000 over their retirement lifetime just on healthcare. So that's all the out-of-pocket cost and Medigap policy coverage and so forth. Now, luckily, that's not all at one time, because 165,000 is a big number, and that's going to be spread out. Of course, a lot of that might be showing up towards the end of our life. In addition to that, that's not including if we end up needing long-term care. That could be an additional 117,000 per person just for the average private room nursing care. So there's some cost there. I like it though, because we are, I don't like the cost, but I do like that we're investing in our health and that will extend our living. So a couple of things to keep in mind. The first strategy that I would say is sit down and budget with us. So it's not a complicated strategy, but we have some software here at Fidelity that we can help you with a budget. And this particular line item of healthcare, we actually do inflate that at a higher than above average, because healthcare tends to be increasing, unfortunately, faster than other things that go up on inflation, because we want to make sure that that expense will be covered and that we will have the resources to access it. Because the more I access it and use it, the better I'm going to feel. So that would be number one. Number two, what typically happens is as I get older, late 70s, early 80s, even into my 90s, of course, I'm just going to access more healthcare, and I'm probably going to need more therapeutics and therapy and medicines and so forth. So let's plan for that particular increase of expense. One way that we can use that or anticipate that is use a thing called a QLAC. Now, I know that's an odd word. It's actually an acronym. It's QLAC. The Treasury Department actually issued a rule about almost 15 years ago that basically said a qualified longevity annuity contract. That's what it stands for. What that means is I can take a sum of my IRA money, so pre-tax money, and I can put it with an insurance company. The insurance company will then invest it, and at a certain point, usually in my early 80s, but not past age 85, I can turn on that annuity to create payments for me to hopefully offset some of these rising costs, especially around healthcare. So just to give you an example, I ran a quote on a QLAC about 2 weeks ago, and if I had transferred $200,000 at age 70, and then I planned on turning that income on to offset some of my healthcare at age 85. So it's in there for about 15 years. I turn on, that would produce about $78,000 worth of additional cash flow coming in. Now, once that's coming in, just keep in mind that 78,000, because that did come from an IRA. I will have to account as that as taxable income. But there is a sweetener there that the government has allowed us, which is that 200,000 out of my IRA that I put into the QLAC. I don't have to include it as part of my RMD calculation. So I get a little tax savings there, obviously to help me offset some of the cash flow needs that I'm going to have as I age.
That was a helpful example. You had mentioned long-term care. So what are some ways that you can pay for long-term care?
Okay, so here's a sobering stat. 70% of us will spend some time in long-term care. So 30% of us won't, 70 will. So that's a lot of us. And it is going to be a considerable amount. So we should anticipate it and not know it now or avoid it. So here's the thing. we don't have time. Like, this is an easy 30 to 40-minute conversation on long-term care. And we have tons of resources on our website with videos and articles. So really encourage you. But at a super high level, for most of us, there's going to be 4 ways that we are going to cover our long-term care need. Number 1 is probably the default is personal savings, right? I'm just going to have to sell something and pay for long-term care. The second way is actually government assistance. So if I qualify for Medicaid, or if I'm a veteran, there's a VA benefit, and thank you out there for your service, but you would have that government assistance to cover for your long-term care. The last 2 is really where I'm getting more thoughtful, and I'm trying to put some insurance policies in place, like a traditional long-term care policy where I'm paying a premium in, and I'm going to get usually a daily amount when a triggering event takes place. Or the last one is what's really is probably grown in more popularity, is what we call the hybrid long-term policy, where, for example, I have a life insurance policy connected with long-term care. So if I'm the 30% that doesn't need it, then the life insurance kicks in. If I'm the 70% that will need long-term care, it'll kick in. So it's kind of addressing a couple of different things. Now, just real one thing to consider, because most people that I talk to, they just kind of default to, well, I'm just going to pay for my personal savings. One thing that I want to really make sure that you understand, long-term care is not determined by age, it's determined by event, when I'm not able to do certain tasks. We assume that that'll be, and I hope it is going to be in our 80s and 90s and maybe in our hundreds. I hope that everyone's going to make it into a centenarian status here on the call here. But the reality is sometimes it might be in our 60s. It might be in our early 70s. I might just have an accident and I had a brain injury, or maybe I had a stroke when I'm 62. You might know somebody like that. Am I prepared when I'm 62 to write a sizable check? If I have some coverage, that money becomes available immediately. There is no age limit. It's all about my ability to do tasks. So that's number 1 consideration, is just time. We don't know exactly when we're going to need it. Number 2, if I do have self-pay, and I have talked to many investors, Justin, I've been super successful. My assets have grown. I've been really blessed. And I could write a check at 62, not a problem. Wonderful. Then I'll always ask this follow-up question, and I would just ask everyone to think about this. What is whoever your caregiver, because likely you're not going to probably have the faculties to make these money decisions if I'm in long-term care, what are we going to sell to fund it? And I've had too many times when adult children come in with their power of attorney, so there was at least some preparation ready for this. They say, dad's in care, we need X amount of money, what should we do? And did dad ever talk, are we selling this? Are we getting rid of a real estate piece of property? What are we going to do? There's no liquidation plan. So you need to have at least a liquidation plan. I would argue that a long-term care policy helps with that, because again, it's triggered by the event, not by age. So you can tap the policy and have that liquidation and keep all your other assets basically intact, at least for a longer period of time. So a couple of considerations.
Well, Justin, thank you for breaking down long-term care for us really quickly in that short period of time. Appreciate it. All right, well, let's turn to our 3rd pillar, money and savings. Now, how do you know if you've actually saved enough to retire? Julie, help us, please.
Yeah, this is probably the question I hear the most often, and it's completely understandable. Retirement is a huge transition. On the financial side, it can feel very overwhelming. The first step is to get a clear understanding of what your expenses will be in retirement. Get really granular. I encourage clients to track their expenses for a few months. Think about how that might change once they are no longer working. We look at everything, the basics, so housing, food, utilities, but also the fun stuff, travel, hobbies, and those bucket list experiences. Once we have a detailed picture, we use our planning and guidance tool that takes all those numbers, projects them forward, factors in things like inflation, investment growth, potential healthcare costs. As Justin mentioned, we inflate things at different levels. And this is a great process to go through. And it's really not just about crunching the numbers, but about building confidence in our plan. I love seeing the relief on clients' faces when they realize, oh, I can really afford to do this. I can really afford to do all the things I care about. And if the analysis does show a gap, then we can work together to adjust the plan, maybe working longer, spending less, finding new sources of income. But ultimately, it's about creating that roadmap to let you enjoy your retirement, provide that peace of mind, and knowing you're prepared for both the expected and the unexpected.
That's fantastic. And if I may ask the opposing question, so what do people typically get wrong about their expenses in retirement?
Yeah, great question. The two biggest misconceptions I see are first, underestimating healthcare costs, and second, not accounting for those periodic or more lumpy expenses that just don't happen every month. So healthcare is a big one. People often assume Medicare will cover everything, but there are still premiums, deductibles, out-of-pocket expenses, dental, vision, prescriptions. And as we age, those do tend to go up. So we want to make sure we're accounting for that. And like Justin mentioned, long-term care or specialized treatments too wouldn't be covered. The other is those irregular expenses, things like needing a new car every 5 or 10 years, major home repairs, big family events. Maybe you're paying for a wedding or a big milestone birthday trip. Most people are pretty good at budgeting the regular stuff, the cell phone bill, the utilities, the property taxes, but it's those infrequent things that can throw a wrench in the plan if you're not prepared. The one thing I do want to point out, though, is the good news is many retirees are very surprised to find that with proper planning, their wealth can actually continue to grow in retirement. Thanks to market growth, smart investment strategies, your nest egg doesn't have to shrink every year. And in fact, I see many clients end up with more wealth later in retirement than they expected or than they first retired with, which really opens up to more goal setting around maybe giving or travel they weren't expecting, legacy planning. So the key is really to be as thorough as possible when estimating the retirement expenses and then revisit regularly as your life changes.
Great wisdom, and I love the idea of being open to some of these possibilities. Now, can you talk more about some of those essential expenses and how those might change over time?
Yeah, this is such an interesting topic. There's some great research out there. David Blanchett's work on the retirement smile comes to mind. He found that retirement spending isn't a straight line. It tends to follow a curve, one that looks like a smile. In the early years, we sometimes call that the go-go years. People are often more active. They're traveling, picking up new hobbies, maybe helping out with grandkids. And then they move into the slow go years, maybe in their late 70s, early 80s. Spending tends to drop, travel slows down, hobbies might become less physically demanding, people tend to stay closer to home, daily expenses can decrease, but you still need to plan for the basics and a comfortable lifestyle. And then finally, those no-go years, expenses tend to rise again, primarily due to healthcare and potential long-term care needs. So it's important to have a flexible plan that can adapt and change as your lifestyle does over time. Understanding this pattern does tend to provide more confidence about a retirement plan, and because we can expect to prepare for those shifts in spending.
Right, helpful. Let's think of a scenario here. Now, if spouses don't retire at the same time, what does that mean for their financial plan? Justin, help us.
Yeah, it's getting less and less common that everyone retires and that everything's perfectly planned, that we're all going to retire right on January 1st of this X date. Tends to be this transition period, especially if something happens to one spouse, like I get downsized, or maybe there's a healthcare issue, that maybe I have to retire a little earlier, maybe late 50s, early 60s, while another spouse continues to work. So a couple of considerations just to put this on your radar. Ultimately, I just want to make sure we have a plan. Unfortunately, sometimes we take off the financial advisor hat and put on the therapist hat when there's been friction. And I tend to find the biggest friction between spouses is we just weren't on the same page. So a couple quick questions that I would ask in this kind of scenario when I have one retired and one like delaying and still working for a little longer. Number one, the person that's retiring, we've now lost their paycheck. Is that a big deal? Can we live on the other spouse's paycheck or not? Or do we need to start generating some income from either our investments in order to replace some of that cash flow to make the whole household work. That might push us to start thinking about, when do I file for Social Security, especially if I'm earlier, maybe early 60s. Just keep in mind, I can file at age 62, but full retirement or full benefit from Social Security is actually age 67. So if I do file at 62, 63, 64, something earlier, I am getting a reduced benefit from my Social Security. So how does that weigh into that? Is that okay? The other thing is not so much maybe cash flow related, but is there a benefit by having my spouse retire early that I'm going to be leaving with the paycheck? So maybe that is a healthcare benefit. And just keep in mind, right, I'm not going to qualify for Medicare until age 65. And so do we have to pick up some of that, or does the other working spouse will be able to cover that maybe through an employer healthcare plan? So how does that work together? And obviously there might be some other benefits to keep in mind. We'll obviously lose probably a little bit of 401k match, maybe a bonus, maybe some profit sharing. So just those are considerations. I just want to make sure everyone's on the page. I'll just end with this though. One other thing to be on the page: if I retired early and my wife is still working, and I went to the gym in the morning, I took my nap in the afternoon, and she came home at 6 and there's still dishes in the sink, that will be a problem. So always be on the same time who does what at the house.
Amazing. I'm sure that's probably a common problem even today, not when you're retired. Well, so of course, not everyone is planning with a partner. And for single people, what kind of additional investments might they need to make? Julie, I imagine you see this daily as well.
Yeah, absolutely. It's such an important topic too. For single retirees, investing in relationships is just as important as the financial investments. I can think of one client particularly. I work with a retired nurse. She's a great example of this. Throughout her career, she built strong connections with the younger nurses she worked with. Now she's retired. She still meets them for lunch regularly and has very open conversations about her wishes on how she wants to age, where she wants to be, and of course the financial side that goes along with that. And they've all agreed to support her almost like a chosen family. So for singles, having those conversations, whether it's with friends, family, or community, is key. And think about your support network, and don't be afraid to invest the time and energy in those relationships.
Amazing. And I think of your chosen family for holidays as well. Well, we know that spending in retirement can be a source of stress for retirees, even those who have saved enough to cover their expenses. So what can help alleviate that stress, Justin?
Yeah, I think it comes down to when you know where the money's coming from, then you have that confidence and less stress. If I don't know where the money's going to come and how these bills are going to get paid, then that creates greater stress. So really the first stop here in addressing this, Julie actually mentioned it, it's about figuring out in our budget what is essential and what is discretionary. So the essentials are the have-tos. I have to have this to have my, to sustain my life. Now, here's the one thing: whenever I mention that word essential or what have to, especially with a couple, it conjures up two different ideas. There are some that are happy to live on ramen noodles and plastic furniture, and others that don't, right? And they don't consider that essential. So I would say this: what is essential? Yes, there are basic things that we need to survive, but you know what? Let's not just survive retirement. Let's actually thrive. So what does that mean? And I know Michael's already mentioned it. There are other things that are important: our social interaction, obviously healthcare. Those are also essential. So one way that I ask that is, what gets you excited for the day, to get up, get going? What is it about that in retirement that's going to engage you? I consider whatever that is, fill in the blank, that is essential. And if there's some financial support to make that happen, then I would put that in the essential category. Now, the second category is the discretionary. It's what I call the nice to have. And with the nice to have, yes, it's wonderful, it's great, but I don't need it, or I can skip it for 6 months. What we typically do, if we can break down the budget between this is truly essential and this is truly on the discretionary, then we can go to the next step, backing into how do we align our cash flow. So now that I don't have a paycheck, How do I take my 401k balance, my IRA balances, my Roth? How do we then organize the investments around supporting what is essential and then also what is on the discretionary side?
All right, well, let's focus a little bit on some of this guaranteed income that you mentioned. So, Julie, what are typical sources of guaranteed income and how can that help alleviate spending stress?
When we talk about guaranteed income in retirement, we're really talking about the sources you can rely on to provide steady, predictable payments, no matter what the market's doing. And the most common source, of course, is going to be Social Security. For most Americans, Social Security forms the foundation of their retirement income. It's a monthly payment adjusted for inflation, lasts for the lifetime, and it provides a lot of peace of mind for a lot of people. The second source of guaranteed income we see would be pensions. We're seeing fewer and fewer pensions today. Typically, we see pensions from government employees, retired military, or teachers. They're not as common from corporate plans as they used to be. In the 17 years I've been doing this, I've seen a significant decrease in the number of clients receiving pensions, or maybe it's only a partial pension in some cases too. The third example of guaranteed income would be insured income, income guaranteed by an annuity. An annuity is designed to turn a lump sum of savings into a stream of income, often for life. There are different types: immediate annuities, deferred annuities, fixed or variable, but the key benefit is they provide a guaranteed monthly payment. Income guaranteed by an annuity can potentially reduce some of the financial concerns or the stress and provide more confidence.
All right, well, Michael, what does your research tell us about how income influences retirement happiness?
Yeah, as Julie just mentioned, most retirees rely primarily on Social Security to provide them with a regular paycheck in retirement. And in a former era, you used to have what was known as the three-legged stool of retirement security. So one leg was Social Security, another leg was savings, and another leg was income through a pension. Now, people are not getting a pension anymore, but they do sort of carry their pension around on their back in their defined contribution plan, their 401k. So oftentimes people will arrive at retirement with a lot of money saved in their IRA, but they won't have a whole lot of money in that private income part of the three-legged stool. And I feel like this is a different state of being for a lot of retirees, and they're not as comfortable about spending money out of savings as they were of income. And in fact, I've done some research where I find that retirees who have income will spend significantly more than retirees with an equal amount of wealth. In other words, let's say you had $500,000 that you could use to buy $3,000 a month of income with an annuity, or you just have the $500,000 in investments. If you have the income, you're going to spend a lot more. So one of the reasons why you're going to spend more with an income is because of what's known as longevity risk. And I have an example that I very often give to help people understand the concept of longevity risk and why people don't spend enough in retirement when they just hold investment assets. And it's to imagine that it is your son's birthday, and you've invited somewhere between 5 and 40 kids that are going to show up for the birthday party. And they all arrive one at a time. And when they walk through the door, you have to cut them a slice of cake. So you have a single large birthday cake. You're going to get somewhere between 5 and 40 kids that are going to walk through the door. The first kid comes in, and you have to decide how big of a slice of the birthday cake to cut. Well, you know, there could be 35 kids coming through the door. So you're not going to cut it into 20 slices, even if on average 20 kids are going to show up to the birthday party. So you cut a smaller slice of cake. And then let's say 30 kids come through the door and you're running out of cake and you're starting to get nervous. You cut even smaller slices. Now, what if instead there was a bakery who would make you a deal? They do 1,000 of these birthday parties every year. So they say, well, just pay a little bit more for the birthday cake, but you can slice it into exactly 20 slices, because on average, 20 kids are going to show up. And if more than 20 kids show up, then we will arrive with a second birthday cake, and you can again cut it into 20 pieces. So the end result is that each kid gets a bigger slice of cake, and I worry less about potentially running out. which of course would be a tragedy if a kid comes in and there's no more cake left. I mean, they would cry, they would go to their parents, you'd not get invited to any more parties in the neighborhood. So you're always going to naturally be more conservative. You do the same thing with your retirement savings. You don't know how long you're going to live. So you end up cutting your savings into smaller slices because you're so worried about potentially running out. You can actually transfer what's known as that idiosyncratic risk. You get no reward for taking that risk. You can transfer it to an institution, in this case, an insurance company, and essentially spend as if you're going to live to about the average longevity. And if you live longer than that, then the insurance company is going to be on the hook for making those additional payments. And the fact that a lot of people don't do this, they don't buy themselves something that looks like a private paycheck every month, is a puzzle. It's actually called the annuity puzzle. And it's something that a scientist that study retirement income wonder why more people don't take a part of their savings and turn it into income if it will cause them to spend more and worry less.
All right, that was a super helpful analogy. I am terrified of 40 children running into my house now. But let's talk about annuities a little bit more. So Justin, you broke it down, long-term care, gave us the quick version. Can you tell us, for clients who need an additional source of guaranteed income, how might annuities help?
Yeah. So, and I don't want any screaming kids that didn't get cake either. So, typically we're just trying to get enough income to cover the essentials, right? Because remember, annuities typically don't grow. They're not going to grow, at least the ones we're talking about here. And obviously our pensions and Social Security don't grow. So I do need some other element of growth. But let me be clear what we're talking about. Because when I say the word annuity, and I wish I could see everyone's face right now, because there's always a variation of faces and reactions. I'm talking about an income annuity, or another term, it's a jargon term in the industry. It's called a single premium income annuity. Now, what is that? It is the no bells, no whistles type of annuity. I just put money with the insurance company and they just pay it income amount for the rest of my life. There's no any additional bells or whistles, and they're contractually obligated to pay that for the rest of my life. Just like Social Security, I pay into Social Security with my taxes. They promise, the government, to pay me for the rest of my life. My employer pays into a pension. Usually I accept a lower compensation. I'm talking to some of our government worker friends out there. I'm accepting less for that pension. It's actually part of your compensation for that promise that they're going to pay you for the rest of life. So it's all the same thing where we won't have to worry about running out of money. But the key is, how much should I actually allocate? Again, the starting point is, where is our essentials? Because on the discretionary, we still got to grow. All of these guarantee sources typically are probably not going to keep up with our cost of living over time. So we have to also allocate money towards a growth side.
All right, well, guaranteed income is definitely important. But most of us also withdraw from our savings in retirement. There's a common assumption that says it's safe to withdraw about 4% of your savings per year, known as the 4% rule. Michael, now what has your research found about this?
So let's begin with what the 4% rule is, because I get that question a lot. The 4% rule, which was created by a financial advisor named Bill Bengen back in 1994, what Bill did was he tried to estimate how much you could have withdrawn from your investments the first year. So the 4% part is actually only relevant for the first year. So let's say you have $1 million. According to the 4% rule, you can safely withdraw $40,000 the first year and then adjust that by the rate of inflation every year. So eventually you're going to be spending probably more than 4% of your investments in the future, because you're going to be withdrawing money from your savings. Now, but what Bill found was that historically there seems to be about this floor, where if you'd invested in stocks and bonds in the United States over the course of a 30-year time horizon, you shouldn't run out if you begin with $40,000 from $1 million portfolio and then increase it by the rate of inflation every year. Now, that was 1994. There's some differences between today and back when Bill originally did that study that would make the 4% rule maybe a little bit less secure. A lot of retirees are living beyond that 30-year time horizon. Many asset managers estimate that returns on stocks and bonds in the future are probably going to be a little bit lower than they have been in the past. So it's a little bit less secure. However, it's also a very conservative rule because it tries to avoid running out of money if you make no adjustments and you increase your spending by the rate of inflation, which, as Julie said before, most retirees don't do that. They actually start spending a little bit less in their mid 70s. So you don't necessarily have to keep increasing your income by the rate of inflation because you're probably not going to spend as much mid-retirement as you did early on in retirement. So my preference is to follow what I like to call a flexible spending strategy. So maybe you can start a little bit higher, start at $45,000 per year, maybe even a little bit more, but then be willing to adjust your spending downward or even upward. If the market does well and you get very lucky in retirement, you should be able to get some reward for that by being able to spend more. But I think if you can be more flexible, then you can reduce the likelihood that you have to worry about running out of money later on in retirement because you're spending a little bit less if the markets don't give you a very high return.
Oh, well, that was awesome. Now, panelists, you have given our viewers so much to think about during this robust discussion. But before we sign off, could each of you share a few key takeaways? So, Julie, let's start with you, please.
Yeah, my one key takeaway from today is that there are 3 important investments you can make: your money, your health, and your relationships. And each play a vital role in creating a fulfilling and secure retirement. And it's worth investing in all 3 equally. I encourage you to sit down with your Fidelity representative to explore how your financial plan can help support all the things that matter the most.
Excellent. Justin, how about you?
Yeah, I just want everyone to remember we're not trying to survive retirement. We want to thrive. I really hope everyone's retirement is their best chapter yet in their life, because now we have this open free time. And if we sit down with us and we'll work out all the math and the numbers and help you figure out budgets and cash flow and get that all done so you can engage in what you are really passionate about and take advantage of this opportunity in front of you.
Excellent. And Michael, let's close with you.
I think one of the best news that we can get from the research is that retirees are actually happier. So people tend to be happier after they retire than they were when they were working. So retirement is a good thing. It's a goal that makes sense. It's something to work for. But then why does retirement make us happy? I think the biggest reason is that it gives us autonomy. It gives us control over what we do with our time. And so it's whether it's working because it doesn't mean that we should not work again as long as we're doing something that we enjoy, or if it's our hobbies or travel or socializing. The best pathway to a successful retirement is to plan on spending our time doing whatever makes us the happiest.
Wonderful. Thank you so much. Now, if you have more questions about planning for your retirement, please reach out to your Fidelity representative. If you don't have a representative, visit fidelity.com/find an advisor. And for more timely market updates and insights on other financial planning topics, subscribe to Insights from Fidelity Wealth Management for exclusive invitations to future wealth management webinars and access to our weekly newsletter. Thank you so much for joining us.